Hi, I'm Cindy Morrison, and today on Senior Beat, I have Dr. Ma with us to discuss vascular surgery. Welcome.
Welcome. Thank you, Cindy, for having me.
Welcome. I appreciate you taking the time out of your busy day. As an experienced vascular surgeon with the Vascular Experts of New London office, correct?
Correct.
Yes. What can you tell us about your background?
Well, I grew up in New York, and I did my surgical training and med school training in New York. Okay. I did my residency at North Shore, Long Island Jewish, and then awesome. I went to Boston for fellowships in both burn surgery and critical care. But ever since I was a child, I'd always been interested in blood vessels, and so I decided not to do plastic surgery or burn surgery and decided to do vascular surgery instead. And awesome. So I went to Tufts Medical Center and obtained my fellowship in vascular surgery there. And then I went from there to University of Oklahoma for a few years to become a junior attending there.
I saw that. Very noteworthy, very impressive background you have there, and that's a lot of school.
Yes, it is. A number of years, a total of, since 2004, graduating med school till becoming attending in 2013. So a number of years, yeah.
Like I said, very impressive. So how did you end up going from assistant professor at University of Oklahoma to Southeastern Connecticut?
Well, as I mentioned, I grew up in New York, and my family's still in the Northeast, and with my parents getting a little older, I wanted to come back to the Northeast and be close to family, and Connecticut represents a great state to live and work and practice, and it's in between the cities of Boston, New York, so I'm near major metropolitan areas, but not within the congestion of those major cities.
True, true. And now you and I discussed before that you actually live within the town of Groton.
That's correct.
Wonderful. So you are one of our community.
That's right. So it's part of the Vascular Experts philosophy, which is to create subspecialty care in communities by providing offices in the communities. And then we hire physicians to be entrenched within the community and become part of the community, because I think it provides better care. As does our practice. So yes. I personally live on the Groton side of Mystic, and I love living in this community, and it also gives me something else to bond with the patients with.
Yeah, and they know you're from the area, so they know that you're part of what they're coming from, so that's great. I think a lot of people feel distanced sometimes from their doctors, their practitioners, and so I feel like that might be something that would benefit you guys, and that's a great philosophy that you have there. At the Vascular Experts office, like I said, you're in New London, but you guys are part of a much larger group.
That's correct. Actually, currently I believe we are the United States' largest group of vascular surgery practice. Okay. We have 24 or 25 vascular surgeons that are board certified or board eligible. And we have a total of 9 or maybe 10 now, I'm losing track of the total number of offices, that have opened up across the state of Connecticut, and we continue to grow. And following our philosophy of creating subspecialized care within the communities, it's been very successful.
So I checked out your website for the Vascular Expert, and I love it. I love that it's easy to use. I love that the doctors are listed, and for your site, for New London site, it's you and your cohort?
Dr. Daines, that's correct.
Yes.
Yeah, our web designers and our administrative team have tried to put together a website that's user-friendly for both senior citizens and younger patients as well.
Great.
The younger patients like more access to to know what the physicians' backgrounds are. So with each location, we have bios describing which doctors are from where and what their training is. And also we have a patient portal when you do become a patient to maintain contact with your medical records, as well as the ability to even schedule appointments online. So these are the new advances in the website, but also if for our more elderly patients that prefer just making a phone call, our numbers are there as well too. So it makes it very simple.
I like it. It was very clear cut. I liked also that you did give your bio. Like, that was great. I thought it was wonderful, and that, you know, when I go to my physician, I like to know that I'm not just going to see a doctor, because that can be a little intimidating. I think that people like to feel more comfortable, so then they're able to ask the questions that they feel a little off asking. So
Sure.
I love that you guys have that. Well done.
I think it's important, you know, in this day and age, the medical profession is a service industry to a great extent, and we need to be selective, both as patients as well as physicians, to know who's treating you and what their credentials are, and that creates a better environment for everybody.
Oh, that's a great point. With that said, so at the Vascular Experts Office, what is it you guys specialize in?
Well, as our name says, the Vascular Experts, we are vascular surgeons, and we do the full spectrum of vascular surgery, and that includes both the arterial side as well as the venous side. And to put that into perspective, what that really means in simple terms is that circulation in the body has to go from the heart out to everything, your fingers, your toes, and then it all has to come back in. So on the outward side, it's called the arterial side, and on the return side, it's the venous side.
Okay.
So that's a simple way of looking at it.
I like that. I like that a lot. So if somebody was going to be coming to their office, what are some of the typical symptoms that would you know, motivate them to call your office to make an appointment?
Well, I think that that's a great question, because there's a large variety of things that we do, and there's a number of different symptoms and signs that patients often come to our office with.
Okay.
And again, it's really with that divide between the arterial and venous side. So patients that come with questions about the arterial side can come from a wide variety of signs and symptoms. Some may come with more serious problems, like they're having stroke-like symptoms. Some may be coming in for completely asymptomatic findings that were discovered from their primary care doctors. Others will come in with complaints of difficulty walking or wounds on their feet that do not heal, things of that nature.
Right.
And on the venous side of things, there are people that can come in from a variety of different things as well. Okay. Some for cosmetic purposes, saying they don't like the way their legs look with veins and spider veins. We treat those as well as more serious problems to the spectrum of venous ulcerations, where they have swelling that causes skin breakdown, and that can be very debilitating as well.
I've seen that a few times, and that is crazy. And it's not just the person who's been ill for a while, it's somebody who's moderately in good health that you also end up seeing, correct?
That is correct. So sometimes you don't have to have a lot of comorbidities, but in our population today, people are more sedentary. There are other coexisting medical conditions, and that can result in problems with circulation. And sometimes younger patients will have problems, and they come in with whether it's related to diabetes or a more sedentary lifestyle, that they can have circulation issues too.
I know, and I think our audience would agree. You know, this time of year too, we become more sedentary. What can we do, from your eyes? What can we do to be preventive? What kind of self-care?
So I think that maintaining a healthy lifestyle is really important. And even though we're vascular surgeons, one thing that we always promote is what can we do for our patients and for each other to make sure that we stay healthy. And the things that we always encourage are things like trying to be more active, going for walks, doing things that are important health-wise, eating healthy, trying to stay away from you know, extraordinarily fatty foods, and also smoking is the #1 culprit in vascular health. Almost every patient that comes in with some type of vascular disease is a smoker, and we try to tell people to quit smoking, which can be a very challenging thing to do.
Yeah, especially if you've done it for quite some time. So you get beyond that point, you're beyond the self-care. What I guess the question is what the surgeries and treatments that you do offer there?
So once we get past medical management or best non-operative and
Okay.
conservative therapies. Then surgery for vascular surgeons divides into two major categories, a minimally invasive approach and then the traditional open surgical approach. And that would really be in terms of what's described today as endovascular surgery versus traditional vascular surgery.
Okay. And now you have the treatments, you have the procedures, you have the surgery. You know, a lot of people, their insurance has changed a lot. They're not sure. They don't want to go into your office unless they're sure they actually need this. They don't want to use up their insurance money.
Right.
The HSAs are a big thing. You know, how do you kind of let the people know that this is something that is just going to make their life so much better, that their quality of life is just going to change dramatically?
So I think that it's a case-by-case situation.
Okay.
Everybody's symptoms are a little different, and vascular surgery covers so much these days.
That's true.
So again, when we talk about vascular surgery, we're talking about things that affect quality of life, if it's on the arterial side as well as on the venous side. And we also have a lot of health maintenance things that we can do. We can try to treat patients to prevent a major life-altering event like a stroke. So treatment of carotid disease, which is the blood vessels that feed the brain, can be performed if necessary to prevent a major stroke. And we can reduce, in terms of relative risk, by 50% of having a stroke within the next 2 to 5 years in the right patient.
That's incredible. And how do you, I guess, come across something like that? How does it, you're like, I think we need to check this?
So there are some guidelines that we do follow in our Vascular Surgery Society, and also your primary care doctor can help you decide that. One of the things that we look for are certain risk factors. It's much easier when to determine if you have blockage in the carotid arteries if you've already had a stroke, because then you're being forced to go into the hospital to have that workup. But if you are asymptomatic and you're a former smoker and you have other risk factors, you're diabetic, you have had heart disease, things along those lines, oftentimes the primary care physician will check and listen to your neck and see if they hear something that suggests that there's a narrowing in the blood vessel to the brain. Because that's what triggers a stroke, is when the narrowing occurs, blood flow through there slows down, and you can actually get some things, some small clots that develop and can shoot to the brain and cause a stroke.
So you can definitely change somebody's life by doing these surgeries. They're on the radar. You know that they're somebody who needs to be watched more carefully. If it's somebody who's just refusing to go for the care, is it then that they're at the emergency room and then they end up in your office, or? Well,
so I think, again, vascular surgery covers such a large spectrum. I think it depends on what in particular we're talking about. In regards to carotid disease and strokes, yes, sometimes unfortunately it's a silent killer and you don't know about it until you show up in the emergency room with symptoms of a stroke, which, just for our viewers and our public to know, can range from anything from slurred speech to a facial droop to a sudden weakness on one side of the body, blindness. Those are in one eye or the other. Those are those big signs, and when you have those signs, you shouldn't wait to go on the website and find an appointment. You should be calling 911 and going to the emergency room. Oftentimes, we get patients from their primary care physicians with those risk factors, and the doctors, the primary care doctors, are attuned, saying maybe we should try to manage their health and do some screening tests, which we also provide in our office with ultrasounds that are non-invasive of the neck to determine if there's narrowing.
Well, that's great. Your office sounds very friendly and open and welcoming. I like that. Compression socks. I don't know, but compression socks, that's like one way that I know people like to try and control. Is that something that you would? Absolutely.
So in terms of compression socks, we're now moved from one arena of vascular surgery to another, which would be compression socks are used to treat lower extremity swelling. And there are a lot of different things that can cause lower leg swelling, and one of the things is venous disease. In our legs, we have a system called veins that drain the blood back to the heart, and Mother Nature designed our bodies fairly well, and she put in valves that try to keep the blood flowing in one direction.
Right.
But when these valves start to fail, you start to have progressive swelling in the legs. You can develop varicose veins, spider veins, and these things can actually become fairly debilitating. And in particular, many of the signs and symptoms that people have with their legs are not just swelling, but this vague achiness that oftentimes people say, gosh, I just want to sit down and put my feet up, and that's the only thing that makes me feel better.
Right.
And oftentimes, if you have those symptoms, you might actually have venous disease that needs, or that would benefit for seeing a vascular surgeon to treat.
Right.
And compression socks are our first line of treatment because they provide external support to help keep the legs and veins supported. And oftentimes, patients will not need surgery. They wear compression socks appropriately, and that can slow down the disease process, and sometimes in some patients prevent surgery altogether.
That's wonderful. So the compression socks actually stop the blood from going down to the ankles and pooling, correct?
Right, it gives external support to help the blood drain back up to the heart without pooling in the ankle.
Okay, I like that. So kind of along those lines, because we see a lot of those type of things at the senior center, but we have a lot of people who, you know, you're in retirement now, you're like, yay, I'm going to travel more, I'm traveling more, and that's exciting, but the more you travel, the more you're sitting on a bus or sitting in a plane, and you're feeling that ache in your legs. And how can you, because, you know, you're retired now, you're supposed to be enjoying it. How can you make it better so that's not an issue for you?
So actually, that's interesting that you mentioned that, because I do have a number of patients that, actually the majority of my patients are more on the elderly side, and some of them are retired and want to travel. And there are, again, two aspects, the arterial side and the venous side. And when you talk about traveling with the achiness and sitting in chairs and planes for long periods of time, wearing compression socks helps that. If they're on a plane, getting up every 2 to 3 hours to walk around to get the blood moving is helpful.
Right.
But more on the arterial side, what I often hear from my patients is that they can't walk very far. So they're trying to go on these tours and sightsee, and they just can't do it all because their legs hurt and they're limited. So when they come in for an evaluation, we examine the arterial aspect, which is the forward flow of the blood, and sometimes we find that they have blockages. And that's where we can then offer procedures to treat the blockages with minimal invasive or endovascular approaches that we can do both at the hospital or sometimes even in our office setting, where it's an outpatient procedure under some sedation, and we use new fancy tools and high-tech stuff to get through these blockages. We even have what I call a rotor-rooter device that goes in and cleans out the blockage, and then we can put balloons in and open them up.
Open it up, yeah.
What is commonly known as angioplasty, which was originally developed for the heart, but now we use it for the legs as well. And then sometimes if that's not good enough, we have stents that we can put in, metallic devices that keep the blood vessel open to ensure better delivery of blood to the muscles.
That's a very common word we hear over at the Groton Senior Center. Stents. That is amazing that it was taken from the heart to the legs. I like that, and that you open that up for them to be able to continue, because people are living longer and their quality of life shouldn't suffer.
That's right. And I think that's one of the things that I always tell patients is that some of these things don't require surgery unless it impacts your life.
Right.
It's not a mandatory situation on certain cases. Now, if you have a wound on your foot because you banged it and it doesn't heal and your circulation is not good, there is a real risk that you could lose your leg. And in those cases, that becomes more urgent. And we say, you know what, fixing the circulation is really important because that's the best way to save your leg.
Right.
And just so you know, saving legs is not just about doing a procedure. It's people who lose their leg are at an increased risk of other things that can cause them to shorten their life expectancy. So we want to try to save legs and save lives.
I like that. That's important. So you do, and I know this isn't your area, but there is the wound care aspect of the vascular expert's office.
That's correct. We do participate with our local community hospitals, such as Lawrence Memorial, to aid in limb salvage, and we work very closely with the local physicians in the wound care center to try to get patients to heal their legs and wounds so that they can survive.
I like that. So I feel obligated to mention this because we only have a few minutes left, but we at Groton Senior Center provide transportation, medical transportation for Groton seniors to medical appointments, and your office is in New London, Shaw's Cove?
Yes, that's correct.
So if you were to be a Groton senior who needs to go see Dr. Ma,
or Dr. Danes, my partner.
There you go, I like that. You know, we at the Groton Senior Center can help you with that because not everybody has the ability to drive themselves.
And we really appreciate that, that the Groton Senior Center does that, because I do know that transportation can be challenging. And I want to put an additional comment to that, which is that we take every insurance. There's no insurance that we do not take. And patients that have any questions or concerns about their circulation should certainly feel free to make an appointment to see us.
And you are taking new patients? We
are taking, both of us are taking new patients, and we're very flexible with our timing. In addition, I think that, you know, there's so many things we can't even begin to touch upon here, but some of the things that sometimes patients get worried about is they hear that they're former smokers and they worry about their circulation. When you get to 65 and older, and if you've smoked a lot in the past, there is a part of Medicare allows you to get a screening for your belly to make sure you don't have an aneurysm. And aneurysms are what scare patients the most because they always worry about it rupturing. And so we can do a lot, not just to find them, treat them, but also some of it is reminding patients that at certain points we don't need to treat yet because the risk is not that high. And at higher risk points, then we say, here, these are your options, whether we do it old-fashioned traditional open surgery or the new endovascular minimally invasive procedures.
Okay, and I like that you have that ability to tell them you're not at this huge risk right now, but you have this almost a freedom, because worry can be debilitating.
Absolutely. You know, a lot of times people think about aneurysms as ticking time bombs, but or quite honestly, if there are small aneurysms, the patients should not be worried about them as much, and they just have to know that they need continual follow-up to make sure that they get the appropriate care if the aneurysm gets bigger. Right.
That's wonderful. I really appreciate that information. So you have your website, the Vascular Experts. That'll be on the screen. The office is in New London. And the phone number for the office?
The phone number is 860-772-0380. And that's our local office here in New London. Anytime patients come in, we're happy to do it, take care of them. And I consider us a one-stop shopping for vascular care. And again, our practice philosophy is to keep people in their communities, bringing specialized care to the communities and no longer following the model of having to go to a centralized university setting or centralized big hospital, big city for the care, because much of the minimally invasive things can actually be done in small community hospitals because we have the technology, and more importantly, we have the physicians who can do it. That's fantastic, because people want to, you're having this procedure or surgery done, you're stressed out enough. To be home and local is very comforting. That's right, so, around your family support network. Yes, I appreciate that. So Dr. Ma, thank you so much for being here today. I appreciate it. I hope everyone got great information. I know I did. I know there's more information. We might have to have you back. I know we want to have you back at the Senior Center. So thank you all for being here for Senior Beat, and thank you, Dr. Ma, very much. Thank you, Cindy. I appreciate being here. Thank you.